Hello. This is a presentation for all insurance agents, but particularly for long-term care insurance producers, because many of you are clearly leaving money on the table, and I want to share with you some strategies that can help make you some more money and protect your clients. This is a short presentation called Tips from the Top, where we're going to analyze 3 real cases from real long-term care insurance specialists who use Aetna's Recovery Care to benefit their client and obviously earn a commission. It was recorded November 2021. My name is Jesse Sloan. I'm director of the American Association for Long-Term Care Insurance, and specifically, I'm going to talk about the 2 options from Aetna: Recovery Care, which is what I would call their long-term care light, as you'll see in a minute, or their short-term care policy, and Home Care Plus, which is also long-term care light. Home Care Plus is ideal for those who really have serious health issues and cannot even qualify for recovery care, but you want to give them some coverage and they want some coverage. So if you're relatively new to this subject of short-term care, let me just share a quick overview. Short-term care insurance is the ideal option when a prospect cannot health qualify for traditional LTCI premium. It's also one where they can't afford the premiums or they're too old, since these products go up into the 80s. But really, health is the #1 reason why successful agents are selling this. And especially when one spouse can't health qualify for traditional long-term care insurance and you risk losing both sales, or as you'll see, the inability to go back and make that second sale. So let's look at our 3 examples. Example number 1, husband's 59, wife is 58. In this case, they live in Illinois. The wife was uninsurable with the major carriers available today. She had height and weight issues. Those are very common. I'm sure you come across them all the time. The agent did explain that One America's annuity care might have been an option, but it wasn't for them, because for this couple, the vast majority of their savings were in qualified accounts, and they just didn't have enough money that he felt it was worth having them do something. So he sold the husband Traditional Mutual of Omaha, explaining to the wife that she would not health qualify, but that since they wanted coverage for both, she could get this. She was okay on all the knockout questions. There are only 7 with this policy, and it has a very easy to use system to compare medications. So even in this case, the wife, he noted, had multiple migraines, but none of the medications she took put her on the uninsurable list. So he sold her a $300 a day facility benefit. He used a 100-day elimination period. You'll see in a second that one of the nice things about this policy is it gives you multiple choices for that. And many agents prefer a 0-day, as you'll see, but that's totally up to you. He added a $100 a day hospital benefit. That's the first time I've ever seen that, and you're going to see a quote in the next slide from the agent, and a home care benefit. The Aetna premium, just under $98 a month. So now both husband and wife had coverage. Here was the quote from the LTC Specialist. He always uses and adds the hospital benefit because he explains to people that when you are older, you often go in and out of the hospital, sometimes for shorter periods of time, and then they, discharge you to either get care in your own home or in a facility. So while you don't need the hospital benefit to cover the hospital costs, because typically you'll have Medicare, you get added cash because this is an indemnity policy. And that will help them, because since you have a limited benefit, the cash is actually going to kick in rather quickly, especially if you have an elimination period. And it doesn't add much to the premium. So in his analysis, it's become a very easy add-on to every policy he sells, except, as he noted, if the client is much older. An interesting strategy that you should take note of. Example number 2, husband is 62, wife is 57. In this case, the husband was declined by NGL. Since, as I said, these are all current sales, the agent is still waiting on the letter of explanation from NGL. He may appeal it, or he'll have to figure out a plan B, which I'll describe in a second. The wife's labs showed enough that he knew that she would not be accepted by NGL. So he proposed an Aetna Recovery Care policy for her. You can see the provisions. In this particular case, it has a 0-day elimination period. 100-day obviously will reduce the premium. Her annual premium was a little over $1,000 a year. Now, what's the smart thing I find about this? Well, a lot of agents, will look and say, well, let's just submit and see what happens. And then when you get declined, then you have to go back to the client and say, well, I have a plan B for you. Well, the client at that point feels rejected and also looks and says, you're just trying to sell me something. In this case, and these are, as I said, all very successful specialists, by bringing up the Aetna Recovery Care right at the beginning and saying, this is all you're going to get, he accomplished a couple of things. One, he sold her coverage. Two, if indeed the husband is declined by NGL, it's not starting from scratch. The husband and the couple already are familiar that Aetna is an option, and now he can go back in and sell the husband much more easily than if he was starting to try and convince them all over after they feel rejected. Very interesting strategy. The words from the specialist. He calls the Aetna policy LTC Light. I've done that, as you heard at the beginning, explaining to clients that it's very similar to traditional LTC. Yes, the benefits are lower, but it's got much easier underwriting for those who have health issues and a lower premium. The biggest difference, he admits and explains, is that there's no inflation rider. Example number 3. In this case, husband is 62, wife is 69, and both live in Indiana. Husband was pre-diabetic and he would have been rated due to his build. The wife, traditional, was off the table completely because she did not qualify on the height weight tables. So he went in with an Aetna Recovery Care benefit for both, a plan for both. These are 2 separate policies. There is a couple of things to know. There's no spousal discount with these plans, but they're also unisex rated. So when you look at the slide, you look and you say, well, my God, why is her premium so much higher than his? That's because she's 69. She's 7 years older than him. And so, clearly that's the cost. But if you are just selling a single woman, one of the key attributes of this product is that women do not pay more than men. And that's not true with traditional LTCI, where a woman will pay 30, maybe even 40% more for the same coverage than her husband. So in this particular case, he sold both of them with a 0-day elimination period policy, got the sale for both. The LTC Specialist, he likes showing this plan with a 0-day EP. As I said, one of the nice things about this policy is it's really up to you, what your experience is, how you like to approach clients. Many specialists I talk to put in the 100-day elimination period because it will save money. Also, one of the nice comments from this specialist is, there's no discount for paying annually. So he recommends monthly. And since it's an automatic check withdrawal, that clearly makes it much more favorable. The client looks and says, oh, $98 or $130 or $200 a month. That's certainly much more affordable than having to look and say, boy, I have to put several $1,000s down for this coverage. He also likes the Aetna Restoration of Benefits feature. It's worth knowing about, and we're not going to focus on that at this program, but I'm going to put it out there. If you start to sell this product, it's something you should take advantage of. So in conclusion, Aetna's Recovery Care, 7 questions on the underwriting, 3 questions on the Home Care Plus, and we talk about those a lot. The Aetna online system is incredible. And if you are already appointed, you definitely should be going in and using it. If you are not already appointed, that's something that you definitely want to do, because this is a wonderful, easy product to sell, and has enormous, you can do online quoting, online enrolling, and get all of your information very easily. One of the features that I think you'll find really, really favorable when you're talking to individuals that have health issues is there is such an easy way to screen the drugs that they're on and see if they are acceptable or non-acceptable. So really, you're doing the underwriting before you're submitting applications for folks. Two really wonderful products. So if you're not appointed to sell Aetna and you found this video, you want to request a link to get appointed, call the American Association for Long-Term Care Insurance. There's our number, 818-597-3227. We'll be very happy to send you the link to get you appointed. If you are and you're not selling this, I would definitely suggest that you revisit clients that have been declined, or start discussing it when you know that the client has health issues. Before you do that, spend 10 minutes, access the Aetna Agent portal, kick the tires. I'm telling you, the reason that LTC specialists sell a lot of this product is because it benefits the client and it benefits them, and it will do the same for you. Thank you for watching this video. I wish you good selling.